To the briefing for Thursday, 16th April 2020. The Presidential Task Force continues to monitor developments around the country and provide guidance to subnational entities and all Nigerians on measures to take to strengthen their systems and to minimize the risk of infection. We note the number of confirmed cases for Wednesday, 15th April 2020, which I think represents the highest single-day rise Good. We also note the encouraging number of people discharged from care and management facilities. It is critical to repeat, however, that compliance with the advisories for personal hygiene, social distancing, restriction of movement, early reporting of symptoms, and wearing of masks regularly, especially in public, remain the best measures for the prevention of infections and to slow down the spread. Let me pause here to encourage all our garment factories and tailors all over the nation that this is the time to start producing masks locally using our local fabrics, the Ankara, the Shadda, and all other material that we have, because of our adversary, that as much as possible we should wear our mask whenever we are outside our homes. That way you reduce the chances, in addition to other necessary things that you need to do, of infection or infecting others. The PTF appeals to Nigerians to take responsibility and play their roles properly. As you all know, we are in a state of war against an invisible enemy. Let me also advise that whenever you are outside the confines of your home, make sure it is for very legitimate reasons covered by the exemption, or within the hours relax for the purchase of basic items. Similarly, you should carry with you a valid means of identification. Finally, I urge everyone to please exercise patience in communicating with the law enforcement agents assigned to ensure compliance with the presidential orders. They are there to protect all of us. The PTF continues to count on the collective cooperation of all Nigerians in our effort to contain the spread of this deadly virus. I think it's becoming very obvious now that we need to be stricter, and this appeal is going to the subnational entities, that this is not the time to relax the lockdown in those states. This is the time to ensure that stricter compliance of the lockdown are observed. I will now invite the Honorable Minister of Health to the podium to update you. Thank you.
No chance of forgetting, and there's the best chance of imbibing, and also because it gives opportunity to leave out rumors and false stories. As of today, the 16th of April 2020, a total of 407 people have been confirmed to have COVID-19 infection, and 99 persons have so far been discharged, and 12 deaths are on record as of the 18 in Lagos, 12 in Kano, 2 in Katsina, 1 each in Delta and Niger states. Unfortunately, one fatality has been a medical professional, and I wish to here express my condolence to the family and to the community it came from. But it also highlights the risk to health workers in the COVID-19 response. Patients with mild symptoms are still very highly infectious, and mild symptoms in one person could be a deadly infection in another person. That is why we recommend suspending close relations between grandchildren who may have no or mild symptoms from grandparents whose responses may not be so strong and where the infection can be more serious. Our valuable health workers are urged to adhere to all government instructions and regulations, to always utilize personal protective equipment as the situation demands, to maintain a high index of suspicion for COVID-19 infection, and to protect themselves, their loved ones, and their colleagues. I use this opportunity to again strongly advise my colleagues in medical profession against secretly or privately managing people who have COVID-19 infection outside of accredited health facilities. We cannot afford to have avoidable morbidity and mortality. Private facilities must obtain accreditation in order to be allowed to treat this highly infectious disease. Practitioners engaging in unauthorized treatment of COVID-19 run the risk of being shut down, their hospitals being shut down for decontamination. This next phase of our strategy in the health sector, due to the available evidence of increasing community transmission in Nigeria, now focuses on community response rather than individual travelers and their contacts in society. There will be more community testing, social mobilization at the grassroots to ensure physical distancing, and advisories on the use of masks or improvised face coverings like handkerchiefs or scarves over the mouth and nose to reduce the risk of transmission. Once again, the revised case definition for testing includes all patients with acute respiratory distress syndrome, contacts of persons confirmed to have COVID-19 with fever or respiratory tract symptoms, persons with fever, respiratory tract symptoms of unknown cause, and also persons who are in a cluster where there are many such infections. Despite being the epicenter of the COVID-19 outbreak in Nigeria, the response in Lagos and Federal Capital Territory is commendable as they strive to enhance case finding by conducting house-to-house and cluster testing based on epidemiological assessments. Our ability to do this strategic scale-up of testing over the next 2 weeks will go a long way in promoting detection promptly, testing, and treating people with COVID-19. The national testing capacity shall scale up to 3,000 per day in 13 molecular laboratories nationwide, as activated by the Nigeria Center for Disease Control. The target this week is to significantly increase the national testing capacity further. More laboratories are scheduled to come online in Borno and Sokoto states. States have been supplied sample collection kits and are encouraged to develop innovative methods to improve testing capacity, such as engaging private sector providers to outsource and diversify sample collection sites and improve logistic support. Citizens still have a major role to play by taking social responsibility through adherence to the lockdown measures and regulations instituted by government. The number of persons cured is increasing, and COVID-19 outbreak seems to have provoked some social stigma and rejection of anyone thought to have been in contact with the virus, as well as their caregivers, family, friends, and communities who may be stereotyped or discriminated against. This is not necessary, because stigma can prompt social isolation of persons or groups and drive people to hide their illness, and also prevent them from seeking healthcare. Because a situation where the virus is more likely to spread and increase difficulty of controlling the outbreak response had from COVID-19, or even those who just barely tested for it. Having said that, I want to strongly advise that persons who test positive for COVID-19 enter into accredited isolation and treatment centers for proper management. This not only gives them the best prospect of survival and recovery, but protects their family, friends, domestic and office staff, and their community they live in from infection. If not, it will be counterproductive. We have developed various isolation and treatment facilities to meet all needs and expectations of security, privacy, and comfort, and I therefore urge citizens to cooperate with case managers. The fight against COVID-19 is like climbing a steep hill where we cannot yet see the summit. It is hard, persistent work. We must persevere together to succeed. The whole country is in this together, the same with the global community. I urge you all to stay at home, stay safe, except you really must go out. And if you do that, remember the advisory for hygiene, respiratory hygiene, and also social distancing, and the use of sanitizers and a mask, especially including improvised masks, especially if you know you will encounter a crowd or find yourself in public transport or any other place where people have gathered. Thank you. I shall now invite the Director of NCDC to speak.
And those throughout the day. People have been asking questions. Where are the people living? Where are the people with COVID-19 living? What part of town are they in? What part of Lagos do they live in? So COVID-19 is a pandemic that has hit the world and disrupted lives in an unprecedented manner. With the constant reporting of cases every day on TV, on all our channels in Nigeria and abroad, of course, everyone is anxious and frightened. Unfortunately, this anxiety seems to be leading to stigmatization. But those of us that have worked in public health know that we've been there before. When the HIV epidemic hit our world, we did the same thing. It was even worse because it was a sexually transmitted infection. But this is an infection. It doesn't get to you because you've done anything bad or you've committed a crime. It doesn't get to you because you're an elite or you belong to a certain strata in society. It is not karma. It's not coming back to you because your forefathers did something wrong. It is just a virus. And we have to really think about how we treat people and how we continue allowing the humanity in us to always come through. The people that are infected have families just like every one of us. They have mothers, sisters, brothers, wives. They need to be respected. It affects their mental well-being. Of course it affects their mental well-being. If our response as a society is to stigmatize them. It is preventing our work from happening because some contacts are choosing not to come forward, to hide, to run away, not to answer their calls, because as a society, we have started stigmatizing them. So this is really to appeal to all of us. You know, what makes us a great nation is our humanity, our love for each other. It is what has made Nigeria always stand out. If we start stigmatizing people because of an infection, it will not only disrupt all the great work being done across the country, but it will have a profound impact on our ability to control this outbreak and our ability to get back to life. So as we roll out testing, as we increase our testing, with all the pressure we've had to do so, it will be counterproductive if at the same time we stigmatize those that we're now finding to be infected. Because what will happen is that people will go underground, they won't come forward for testing, but they will be infected. And by being infected and staying underground, you infect others. And the cycle will continue. And the disorganization in our society will continue. And our economy will not be able to come back. So all these things are connected. It is not, we're not asking you not to stigmatize out of some hypothetical risk. This is a real risk to the challenge. So if you're tired of staying at home, if you want to get back to life, please support those infected, support their contacts, encourage them in any way you can. Call your friends if you know who they are. Show them that we support them, we're waiting for them to get well and come out. We've so far discharged 128 people. 128. Show them your love wherever you are, reintegrate them into our society. As I emphasized last week, that while we maintain a reasonable fiscal distance, we do not want to be socially disconnected. In fact, at a time like this, we need to be more connected than ever before. In these times, what unites us is more than what divides us. Let's show empathy to others. Together, we can take responsibility in the fight against COVID-19 and associated stigma. Thank you very much.
First of all, I'd like to talk about the issue of travel restrictions and to re-emphasize the need for people to stay at home, especially in the FCT, Lagos and Ogun. I would also like to briefly note the issue of people traveling in between states, interstate travel. We have noticed that community spread is now being traced from people traveling across state borders. We need to try and restrict our movements in order to stop the spread of coronavirus infection. This is particularly pertinent with regards to the news of people being smuggled in trucks out of Lagos, which is quite concerning to us. Moving on to the issue of distribution of palliatives, I would like to highlight the need for donors to safeguard life and basic health protocols during the distribution of palliatives within local communities. It is important that they maintain health and safety. The rise of aggressive behavior and the non-conformity to physical distancing is unacceptable and is a major risk to our communities. It's a serious public safety concern. I enjoin donors to work closely with local authorities and to ensure that the mass gathering restrictions and the physical distancing guidance that we have given is abided by. On the same issue of donors, I would like to remind donors that intend to support the COVID response on the importance of working with us through the Presidential Task Force to make sure that donations are relevant to our needs. We need to make sure that we do not purchase substandard goods or put quality assurance standards aside in the process of trying to increase our resources for the response. This is particularly valid for state governments as they go on to purchase PPEs for their healthcare workers as well as frontline staff. We will be providing guidance on the sort of standards we expect, which is derived from international standards, including the WHO standards for PPE and other equipment for the response. Finally, I know previous speakers have talked about the issue of stigma, which continues to be of concern to us. I would like to appeal to survivors of COVID to please tell their stories, but at their own discretion and for the purpose of reducing the stigma and discrimination associated with this illness. We can see how celebrities and other persons from outside the country are working very hard to enlighten the populace and prevent discrimination and ignorance. This has worked with other disease conditions such as HIV, and we are certain that it will work for COVID as well. While doing this, while supporting us, it is important that we continue to respect privacy. But if you are a survivor of COVID and you are willing to share your victory, because it is a victory, then this will definitely help us towards getting on top of the pandemic. Thank you very much.
International Monetary Fund. I should nego na were obodo irini sato no irini tena ha yeshiri ego ka ha were nuso ayanwa ọgụ mana na he Nigeria so ndị ha ka eme ka ha ye ndị ba ndị Nigeria mana ihe mgbe ha yere ya bụ ego ha yeshiri ndị obodo ego aha irini tena ha chere na ọsọ obodo dị ogbenye na-enweghị ego ncha ncha bụ ha họpụtara ya bụ ego and unu amara that na obodo anyị nwa bụ Nigeria ha chere that na economy anyị bụ kacha n'Africa niile so mgbe a na-ekekwa ihe eke ndị obodo ndị ogbenye anyị aka eso n'ime mana adị m sure na the minister na-enete finance na ọ ya eme nnọọ ike ka ahọpụta Nigeria na-anọkwa eke ego ọzọ dịka ọha. So what I was saying was essentially that, well, the last time actually I spoke in Igbo, I spoke in Central Igbo, you know. So a lot of people wrote to me and said, hey, look, listen, you know, you're a Wawa and you should be speaking the dialect. So that this time I'm going to to speak in a dialect, and I hope that the questioner will understand my dialect. On the issue of evacuation of Nigerians, where we are now is that we have received all the numbers from our various embassies around the world. We are collating those. Then we have now selected 2 airlines that will be responsible for going to fetch them. The numbers are high, and the places where we can isolate them are not enough for those numbers. So we will have to do it in a staggered fashion, and together with the National Emergency Management Agency and the Ministry of Health, we will have to come to an agreement to be bringing back according to the numbers of beds and so forth that are available. But as I said, we have now identified the airlines that will go out in the process. So we're almost ready to go. Thank you very much.
In particular, the National Orientation Agency is not doing enough to sensitize Nigerians, to enlighten Nigerians about COVID-19. It's fake news. It's fake news, and it's fake news. And I have the independent polls conducted by the NOIP, which is the most credible company in the whole of West Africa for this kind of polls, which was also sent to us by the UK Prime Minister's Office Communication, which is partnering with us. And the result is this. It says 99% of Nigerians say they are aware of COVID-19. 6% of Nigerians say it is not real. And of this 6% is broken down to Northwest, 4%, Northeast, 8%, North Central, 5%, Southwest, 3%, Southeast, 10%, and Southeast, 12%. The polls also ask Nigerians this question, and it said that 28% of Nigerians say they are immune to COVID-19. And the reasons they gave are as follows. 42% of them said, I believe in God. 35% of them said, I follow preventive measures. 11% of them said, I'm a black person. 5% said, hot weather will not allow it to catch me. While 4% says, I eat good food. The poll also went down to ask Nigerians, do you think the FG's decision to lock down FCT Lagos Ogun is correct? 18% said it's too extreme. 77% said it's appropriate, while 5% said not sufficient. So if you want more information, I'll give you. But I tell you, this is not from us, from NOI polls. So all this, allegation that there's not enough, public enlightenment is fake news. Thank you very much.
We must commend the endurance and resilience of all Nigerians over this period of a national war against the invisible COVID-19 on all space of Nigeria. The war is grim and tasking. We must thank God for His mercy as we are thanking our fellow compatriots and the frontline and health workers for their resilience and commitment. Let me seize this opportunity to admonish Nigerians living in our border communities, in the states sharing borders with our West and Central African neighbors. And these states are Lagos, Ogun, Oyo, Kwara, Niger, Kebbi, Sokoto, Zamfara, Katsina, Jigawa, Yobe, Borno, Adamawa, Taraba, Benue, Cross River, and Akwa Ibom. These are the states ring-fencing Nigeria from our neighbors in the west to the north and the east. I'm seizing this opportunity to admonish them to promptly report any illegal entry of anybody across our borders and alert the officers and men of the Nigeria Immigration Service. It is in our collective interest to prevent opportunistic entry of COVID-19 into Nigeria by any means. We, as a people and a nation, have sacrificed a lot of our time, energy, resources, and wealth as a people and a nation, that it is best to take the maximum advantage of the gains we are making on the containment of this virus by being alert to any movement at all across our border by anybody except our own citizens, who even as well we must report to the officers and men of the Nigerian Immigration Service. These gains come at a very, very high price. We are all paying it. It's taking tolls on our economy. It's taking tolls on our spiritual life. It's taking tolls on our social life. So we must therefore not take it for granted. We must support the government to keep our borders secured against the virus. This said, I owe the lady who spoke in Arabic first and later English just this answer. In the speech I made on Thursday last week, while delivering the president's message on the release of some inmates in our custodial centers, I titled that speech, "Compassion is the basis of morality." It's not a slogan from me. One German writer said so, and I agree with him absolutely. Our hospitality, our philanthropy, our high sense of compassion are the classical hallmark of Nigerians. So no foreigner from West Africa, Central Africa, or outside Africa will suffer neglect or lack of care in any part of Nigeria, from Nigerians or by Nigerians and the government. That explains that. Identities of freed inmates. From the speech again I made during that, when I was announcing the presidential amnesty, I was clear that the federal offenders that were to benefit from that first phase, because it's just the beginning, and I made it clear in my speech that that will be the beginning of the exercise. It's going to run for quite a while because of the number we have there. The number of federal offenders that were given amnesty was 70. That the remaining 2,600 were state offenders. That based on the criteria established, the president has approved for the Attorney General of the Federation to contact respective states, and I gave the number of beneficiaries per state that the Attorney General will write on to the states to release, and they are releasing them. I've read about Kaduna and some other states. So please, it's unfolding. And it's not even limited to what we have done. We are committed to decongesting our custodial centers. I could not get the second question about 2.1 million or something. I want to assume the lady from Arise should by now have the correct thing about that amount of money, what it is meant for, what she wants to know about it. I wouldn't know. So if you can please explain yourself, I might be able to help. Okay. Thank you. I've now understood. It's 21 million, not it's 21,500,000 naira. Please. When it comes to money, everybody is oversensitive. What I said in my speech on that day was that as a condition for releasing some, about 800 of the inmates, is the need to pay fine. And we pegged it at those who have a fine obligation of maximum of 50,000 naira, that we have penciled them for release, and that total sum is about 21,500 naira, which we expect the state governments to pay to themselves. Let me explain this, because this is quite interesting. FCT paid for his own inmates that fall within that bracket of inmates having fine obligation of maximum of 50,000 naira or below. FCT paid his own sum. I couldn't recall the figure now. And we recommend to the state governments to equally do the same. And let me explain to you what we mean state government paying to itself. A court judgment is already an obligation that cannot be obviated. However, if the state government pays the fine to its state judiciary, the money goes through the state judiciary to the treasury of the state. And it's the state paying itself. It cannot be waived because it's an obligation, being an order from court. So the order must be obeyed by the government paying the state judiciary, and the judiciary dropping it in the state treasury. So it's in to in. So it's 21 million naira, 500,000. It's 21,500,000 naira. It's not coming to federal government. It's going to each of the states that have recommended those inmates for release with the fine obligation. I hope that's understood now. It's 21 million. It's 21,500,000 naira. Now on garment. I know the chairman will talk on this, but it's always nice to use the opportunity of this engagement to sensitize our people to what we owe ourselves. It's getting very clear that the tropics does not allow people to huddle in their houses. The tropic is an open space where intensive social interaction is natural. If that is the case, and we now have to live this very difficult and strange life of being indoor, it will be inconceivable, and may God not allow it to happen, that we stay indoor forever. But for economic reason, social reason, spiritual reason, we can't. If that is the case, the only thing possible, therefore, is to have a minimum prevention system. A minimum system of ensuring that people are prevented from being infected by this virus. And the face mask, to observance of physical and social distancing, personal and respiratory hygiene are maintained. So if that is the case, Let's take our population to be 200 million. Let's say half of that population are active, semi-adult to full adults. It's more than that, but let's even say half, 100 million. Let's now assume that the cost, I don't know, I'm just assuming, don't quote me. Let's assume that the cost of local production of this guard is 500 naira. That business alone of mass production will generate a 50 billion naira business. So if that is so, I want to recommend this. Rather than look at government for grant, let individuals that can mobilize seamstresses in their respective area to produce this thing and help people in their community. Let chairmen of local government areas, let councillors, let officials of government and those with means support this exercise by mass producing from local producers, seamstresses, ladies, women who can do this. We have been told by experts that our ordinary textiles can go a long way in producing this mask and serving the purpose of preventing the droplets of the virus from attacking us. So I'm with this appealing, or I'm by this appealing to all of us that have the capacity, one, to organize seamstresses in our respective communities. Leaders of community, leaders of religious organizations, leaders of associations, trade and social, political leaders, everywhere. Let's come around to support the containment of this virus by mobilizing those with capacity to produce masks with our cloth that we can use year round. And I'm quite hopeful that with this, in no distant future, Nigeria will be a safe haven and a no-go area for coronavirus. I thank you for your attention.
With the states, as if we are not working in concert. Paragraph 2 of my speech this morning did emphasize that when I said that the Presidential Task Force continues to monitor developments around the country and provide guidance to the subnational entities and all other Nigerians on measures being taken. We are working in a collaborative manner with states all over the Federation. I have been in contact with them through the Governors Forum, and even yesterday after our video conferencing meeting with the President, the DG Center for Disease Control and the National Coordinator of the PTF were on with them for several minutes discussing synergy and how we can harmonize our response so that we have one national response. I must commend the states because they are doing a good job. But you heard me say this morning that this is not the time to relax any lockdown. A state has gone from 1 index case in under 1 week to 21. So it's a serious business, please. It's not a joking matter. And this is not the time to play any game. It is only our collective resolve as a country that can help us deal with this pandemic. So I'll continue to emphasize the fact that we have one national response and scientifically proven the only way you can drastically reduce transmission is through the lockdown. Once people don't come in contact with each other, we'll be able to trace those that have appeared on our radar as persons of interest, follow them up, track them. If need be, test them. If they are positive, take them into isolation, remove them from cohabiting with other people that are not infected, take them into isolation, and give them the appropriate care. But as long as we allow business as usual, people getting together, partying, then we should be prepared. We should be prepared to deal with the consequences of our actions. So I will continue to make this a passionate appeal that given these 2 weeks, I must commend the governors that have taken bold steps in locking down their states so that the needful be done. The Quarantine Act signed by Mr. President has direct bearing on Abuja and Lagos and Ogun. So we have responsibility to ensure that this lockdown in these 3 locations are effective and geared towards producing the desired results and objectives for which the extension is granted. And that brings me to the second question that talks about difficulties of accessing movements and harassment by the law enforcement agencies. I'm not holding brief for the Inspector General of Police and all the other security agencies. But you know where I stand on this matter. I've spoken about it some time ago when I said it's a Nigerian phenomenon and civility is reciprocal. If you are civil in your approach, you ordinarily attract a reciprocal civil attitude from the other party. And it's a cultural issue, it's a mind issue that I believe strongly that in spite of what COVID-19 is doing to us as a people, but coming out of it, I believe we will learn very good lessons and we'll begin to deal with matters and deal with ourselves in a different way. I expect that our security agencies will be polite in interrogating whoever desires to have access during this time of lockdown. And that was why I said in my speech this morning, when I said I was requesting the security agencies to please exercise patience in communicating. I mean, our people should exercise patience in communicating with the law enforcement agents assigned to ensure compliance with the presidential orders. They are there to protect us. But in the same vein, the security agents too are not expected to be overzealous in dealing with our people. I totally agree, having been locked down for 2 weeks, and particularly for those that earn their means of income on a daily subsistence basis, there is anxiety, there is apprehension, and the pressures of life kick in at that particular moment. But this is a time that we must exhibit decorum, we must be patient with each other, we must try as much as possible to endure and accommodate sometimes even excesses. Knowing the Nigerian people very, very well, because I'm one, this is not the time to take undue advantage. This is not the time to take undue advantage. This is the time to show our true sense of nationalism in this regard, and to ensure that we do everything collectively to have an upper hand in our fight against COVID-19. So in summary, what I'm trying to say is that as much as possible, the security agencies should be patriotic in their actions, should be accommodating, should be polite, and should restrain themselves even in the face of provocation. But in the same vein, the civilian population too should be civil in their conduct. And lastly, the question that has to do with whether we have a budget for research. I can assure you that we have a budget for research, and we are partnering with the Nigerian Institute for Medical Research, because this is a novel virus. Even from in the place from where it originated, they are busy trying to lay their hands on possible vaccines or other drugs that can be used for the purposes of cure. So every country is mixing whatever they can mix. Here in Africa and in Nigeria in particular, we would put a little bit of the Nigerian sense in it, like the Honorable Minister for Aviation said here, in his part of the country where he comes from, people are saying that they can eat some fruits, they can swallow some things, but that is not scientifically proven. We would do the needful in terms of a proper medical research to see if Nigeria can have a leeway or a headway in getting to the creation or invention of a vaccine or a combination of drugs that can be curative in dealing with the coronavirus. As of now, there is no cure that has been proven scientifically. There is no vaccine in the market that can be administered. All we are doing is to put in place the non-pharmaceutical initiative and the medical care that can be given to those that are being infected. I want to thank you.